Today you were one of the moderators from the session on New Horizons in Vision Restoration, Innovations in Regenerative Ophthalmology. Could you summarize some of the sessions and talks that we had heard today?
Sure, and thanks very much for asking me to speak. David Calkins and I ran the session on regenerative ophthalmology, and we included speakers talking about optic nerve regeneration and also trabecular meshwork regeneration. There was a very interesting talk by Adriana DiPaolo on the effect of insulin on retinal ganglion cell regeneration. Great talk by Yi-Chin Du on using stem cells to regenerate the trabecular meshwork and normalize intraocular pressure. A very nice talk by Carl Cater on optic nerve regeneration and using guidance for the axons of the retinal ganglion cells to get back to to form the optic nerve. There was a good talk by Ken Mandel about the Neurotech implant and using that CNTF implant for retinal diseases, including glaucoma. And then the final talk was by Jeff Goldberg, and he spoke about using that implant for neuroenhancement. So all sorts of different approaches to regenerative ophthalmology in glaucoma. I think that the future is looking very bright.
When you think through all these innovations that you have heard about, talk about today, what sticks out in your mind as maybe the most potentially changing therapies for regenerative ophthalmology? Or
Yes, so I think that Adriana DiPaolo's talk on the use of insulin drops, eye drops, to kind of do neuroenhancement or even neuroregeneration is really fascinating, and could be a therapy relatively quickly. I also am excited about the trabecular meshwork stem cell work that Yi-Chin Du presented, but it is a little bit further from actually getting into human beings. On the other hand, it could be a cure for high pressure in glaucoma.
Mm-hmm. So where do we go from here? What do you anticipate at next year's meeting?
Right, and I should have mentioned also that the Neurotech implant in the phase 1/2 studies is looking very promising, and that could also go in. It's already in clinical trials, so it's actually ahead of Adriana's what Adriana presented as well as what Yi-Chin presented. In terms of next year, I hope that we're looking at clinical studies on Adriana's work and on Yi-Chin Du's work, and I hope that we're going to be seeing a phase 3 study get started on the CNTF implant.
Mm-hmm. Okay, thank you very much.
Great, thanks so much.